Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family practice physician here in town and Chief Medical Officer of Good Samaritan Physician Network. Happy to have you back with us. I'm joined today with Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital. I'd like to point out that we have an invisible barrier that is in between us today that separates us, and we've both used our hand sanitizer. So, Adam, if you want to lead us off.
Sure. I'm going to ask a few questions that we have prepared just for conversation and to answer a number of things that we've seen on post or questions that have come in through our hotline, and then certainly we'll take live questions as well. So as many are aware, now there are 2 confirmed cases in Knox County. So the question has come up, what does that mean for our community?
So the important thing is that this is what we've been anticipating and planning for weeks now, and we're at a great advantage being in relatively rural America because we've had the experience of watching some of our colleagues in the larger cities as this has marched through their communities, and we knew that this was coming, and that's what a lot of our preparation and planning has been for the last few weeks. The big thing that I think it helps is it helps to solidify that what we've been doing is the right thing. So everybody's been doing an excellent job of social distancing. Kids have been doing homeschooling, and it's important that we stick with that because now we know that we have confirmed cases in our community. We've known for several weeks that there are probably other ones out there, but it's important now that we know that it's here, that all the preparation that we've been doing up until now has been working to flatten out that curve and delay the progress of the disease in our community.
Are the 2 cases self-isolating or hospitalized? So currently the two cases confirmed in Knox County are at home recovering, so they're in self-isolation. They are not in the hospital. One of the processes that you may have heard from Dr. Stewart as our Knox County health official is that the public health officials of each county where there are positive cases are responsible for monitoring those individuals. It's a daily process that they are following up with them, managing symptoms, staying in touch with us, obviously, as the healthcare provider if those resources were to be needed. They also go through a pretty diligent process called a contact tracer, where they're asking who the individuals have been in contact with, and there's some definitions as far as close contact at less than 6 foot that you've probably heard, as well as prolonged time. So greater than 15 minutes of prolonged contact, close contact, and then anyone that is deemed to have met that criteria will be contacted by the public health officials to follow up in a manner of are they exhibiting any symptoms, and follow the process in that regard.
And one of the things that Adam brought up there that's very important is as we progress over the next few weeks or so, we're all going to know people and have family members and friends who turn out to be positive for COVID-19. That's why it's important for all of us to realize that we should just self-monitor and keep track of your own symptoms, because many people who will be exposed to this won't get any symptoms whatsoever. Many people who will get exposed to it will have very mild symptoms, and so it's very important you stay in touch with how you're feeling, whether you have any symptoms that are progressing or getting worse, and that's the point we want you to come in and get in contact with our call line.
So as we continue to see patients throughout the community, we have our respiratory clinic, and the numbers at the respiratory clinic for the first week, we saw over 150 patients at the clinic. Throughout the week, actually saw a few less towards the end of the week, but that can ebb and flow based off of needs. So as we continue to utilize that as a service, we have the triage line, we have the respiratory clinic, as well as virtual visits, all in place to help to address any of the COVID needs of the community as part of our response. One question for Dr. Stine is what are the symptoms being reported at the clinic, and as related to testing? So what type of symptoms are we seeing when we say respiratory illness?
Sure. So most commonly we see that people that are coming in with respiratory illness are coming in with cough, congestion, and fever. However, as we talked about in some of our previous Facebook Lives, those symptoms cross over to many other processes as well, including allergy symptoms and symptoms of the common cold and symptoms of pneumonia and symptoms of COPD exacerbation. So really it's the progression of those symptoms that concern us the most. So when we see a lot of people come in with mild respiratory symptoms and they're feeling fine otherwise, and they're eating and drinking, and they're not having any respiratory symptoms of shortness of breath, those are the people that we evaluate and then send with home care instructions. And one of the important parts of those home care instructions is to get back with us if for whatever reason those symptoms progress, meaning that you're having increasing cough, increasing problems with breathing, difficulty doing normal tasks around the house. Those symptoms become concerning enough that we want patients to come back in and get reevaluated, where they potentially would get ruled out for other illnesses, potentially get a chest x-ray performed, and a clinical evaluation so we can listen to your lungs. So the mild respiratory symptoms we're still dealing with exactly the same way that we talked about a few weeks ago, which is if your symptoms are relatively mild, you don't need to come in, you don't need to be evaluated. But if those symptoms seem to progress or you're having more difficulty day after day, we want you to come in and get clinically evaluated so we can determine if any other additional testing is needed.
In regards to testing, so now that we have positive cases, has testing guidelines changed?
Testing guidelines have not changed at all. The thing that is going to be fairly exciting over the course of the next couple weeks or so is the availability of more rapid on-site testing. So everybody, going back 3 weeks ago, we were told by the government that the testing was here and everybody could go get tested. And the reality of that was, in most places, we didn't have the availability of those tests, and we were encouraged to basically follow a very strict guideline on the sickest patients who were potentially going to be hospitalized were to be the only patients to be tested. There are several companies that have done a fantastic job of ramping up their production of those tests that are going to be more rapid on-site tests, and I think we've been told within the next week or two we should have those tests on site. And that will change things considerably in terms of with the drive-up facilities that we have already in place. If those rapid tests become available, we'll be able to tell people within 15 to 30 minutes if their test is positive or not.
So as a community, how can we work together to stop the spread? So we'd be remiss in any COVID Facebook Live if we did not mention social distancing, shelter in place, many topics that you've heard. Essential travel only with shelter in place. I think that I've noticed as the weather has gotten a little bit nicer outside, that the essential definition, being very subjective, has been maybe a little lax. We have positive cases in our community. We expect that's many more than 2, and certainly can pose a risk if we're out traveling for non-essential needs and interacting with individuals. So please take that seriously, as well as practicing good hand hygiene. So Dr. Stine, what's your advice for people that are traveling as for essential needs such as food or gas, making those essential trips? You know, I've heard things from, I don't want to buy any products that say they're from China, to what if I touch the same plastic container as somebody else had touched?
So the most important thing to realize is that COVID-19 does not get into your body through your hands. Okay? Our hands are merely a vector to take the viral particles and put them into our eyes, into our nose, into our mouth. And so using good hand hygiene and using hand sanitizer, not touching your face, and separating yourself from other people, that's the basis of what we've been doing for the last several weeks, and it's working. If we look at how this disease has spread in more populous areas versus here, we're doing an excellent job, and so I would compliment everybody on what a good job they've done with that. But the fact that we all have to go out and go to the grocery store, and we have to get food, and we have to go to doctor visits and so forth, doesn't change any of that. There's no real need at this point in time for everybody to be wearing a face mask, and in fact we would encourage most people not to do that, because you're consuming the supplies that may be needed to take care of one of your family members a week or 2 down the line, and it's really not helping you to not spread the disease or catch the disease. So it's important to make sure that you're washing your hands, that you're using hand sanitizer, and then when you do go to the grocery store, once you get done at the grocery store, you wash your hands, you use your hand sanitizer, and then you proceed as normal. Adam pointed out that with the weather getting much nicer, that we all get to go out more, and we still encourage everybody to do that. One of the things that's creating fallout from all this is people are cooped up inside. They're depressed, they're anxious, they're on social media and the news all the time, and that's making them even more worried. So we want people to get outside. We want them to exercise. We don't want everybody cooped up inside together just worrying about this. So the more that you can go outside and enjoy the nice weather that we've had and separate yourselves, the better off we'll all be.
And I would add, with those essential travels, it's good to have a plan, and when you're out making an essential trip to try to accomplish as many tasks at one time as possible. We're all used to an on-demand lifestyle where if we forget something, we run and grab it, and this is a time to be a little bit more thoughtful in your planning. So many of you probably saw President Trump's announcement yesterday regarding the extension of social distancing for another 30 days, so through the end of April, and we've been asked what our thoughts are on that. I think it just embodies that this is a very fluid situation and it continues to develop. The president is surrounded by healthcare officials that are modeling out the information to look at where the peaks are and the growth of cases. And so, for one, I applaud the president for looking at an initial date and being comfortable in changing that. I think that one of the comments that he made that was pretty relevant was that it would be a major misstep to claim victory before there was a victory. And certainly we have seen other countries that have relaxed their social distancing and shelter in place rules as they've seen some downward trending of cases that immediately saw a resurgence. So in moving that, it's the right move for the country. And it's something that, certainly as healthcare officials that we look at and in Indiana specifically, we look at the peak of cases is not here yet. So until that peak is identified through modeling of cases and we get that information, these necessary steps, while they're uncomfortable in impacting our lives with social distancing and shelter in place, really are important. How is the hospital preparing for the next few weeks and planning for a surge?
So as Adam had alluded to, the important factor is that we're getting the opportunity to see what's happening in other locations. And so for the past 3 or 4 weeks, all of our preparation has been in anticipation of what's happening in the larger cities happening here. So Adam can speak a little bit to the numbers, but bed expansion and making all the resources that we know are going to be necessary around here available has been the focus of this over the course of the past few weeks or so. And the other thing that we have done is basically, Adam and I both came from larger systems, him at Barnes in St. Louis and me at Northwestern in Chicago, and we all have the great opportunity to speak with all of our colleagues that we went to school and trained with and worked with for many years to find out how things are going there and what protocols that they are using and what experimental drugs they're using and when they would use those. And so one of the great things that's happened just over the past week or two is there have been a number of actual studies that have been initiated on some of the medications that are being considered. So rather than just shooting from the hip and pulling drugs out that we think might be helpful, thankfully researchers have gotten fast track approval from the FDA to go ahead and do those studies, and over the course of the next few weeks when we're going to need those medications, we'll actually have some good hard data that talks to this medication actually helped, we thought this medication would help and it didn't, and then we can use that here in our community, whereas the larger communities didn't get an opportunity to do that.
Yeah, I've been very fortunate to steal shamelessly a lot of information from areas that have been impacted, as Dr. Stine mentioned. And something that I'm proud to mention is where we have already created a number of protocols and plans, they align with what we're seeing elsewhere. So you have a really good team that is working on this and pulling information together. We feel like our plan is really strong in being able to address a COVID surge in the community. It continues to adjust day by day. So one thing that I've mentioned on previous Facebook Lives is that we meet twice a day to discuss how are we planning and where those preparations are, as well as pretty much every day, all day between those two meetings is putting those plans together to make sure we have the best response, and learning from organizations that have already lived through it in missteps or what they wish they would have done sooner. We're fortunate that the social distancing, the shelter in place that the community can impact were put into place before we started seeing a large number of cases, whereas many communities enacted those rules after they had seen widespread transmission, and now they're dealing with a doubling factor of cases. Certainly across Indiana, Indianapolis has been hit really hard. We stay in close contact with the entire state through the Indiana State Department of Health. There is also IHA is the Indiana Hospital Association, and there are weekly calls amongst all hospitals in the state looking at resources, looking at how we can help each other out. This is not a time where healthcare is business oriented. This is a time where healthcare is very focused on the health of our patients. And it's no longer just the health of the patients in our community, it's the health of patients in our state, the health of everyone across the country, and how we can make that system work to take care of as many people as possible. So are we getting advice on how to handle a surge of patients? So from CDC at a national level, from what we're seeing at even President Trump's advisors to state levels. We continue to talk about a surge of patients. We're fortunate that there is starting to be created a number of modeling around data, so we're able to look at what potentially could impact Knox County and surrounding counties. One thing that's really difficult in that regard is most modeling is built around larger populated areas, and Indianapolis to St. Louis, certainly New York City, that has almost 50% of the total cases in the United States. So we do look at those and apply our own data, and it gives us an idea for that planning, and it helps Dr. Stine and our physicians to ramp up what they need as a physician resource as well.
And just to kind of put into perspective, the things that have come to pass over the course of the last couple of weeks or so in terms of ramping up bed space, potential critical care beds is absolutely amazing. I mean, we've taken a hospital that normally would accommodate 88, 90 people for our normal bed space to a potential for up to 250 if we would need it. And so that's where we're ahead of other people in larger areas, is that we've had time to work on all that, and we've had time to look at staffing and room space and beds and all those types of things, and we've had tremendous help from our surrounding areas to help us with that. So that's what puts us ahead on that.
Yeah. So I want to switch gears a little bit and make one announcement. So as we look at the number of positive cases in our community, as that gets reported, it's important to clarify that reporting is based off of the county of residence. So when an individual is tested, say a Good Samaritan, if their county of residence is a Gibson or Sullivan or Vigo or Vanderburgh, that will get reported there. We did learn over the weekend that we tested one of our employees based off of information that we had received, and that individual did test positive. That is not one of the two Knox County positives, because that individual does not reside in Knox County. So similar to what the public health officials do, we have performed a contact tracer, have looked at where there's potential risk. We did have 5 employees that are quarantined. So they're at home. The positive individual, as well as all quarantined, are asymptomatic, recovering well. No one's in the hospital. The employee has very limited patient care contact, so no patients were at risk. There were no patients that fell into the category per the CDC that need to be notified, need to be quarantined, anything of that nature. You've probably seen across the country, if you've followed COVID, there are a number of healthcare workers that have come in contact with COVID, many of them direct patient care, and it's related to caring for COVID patients. In this case, as the tracer was performed, our employee came in contact with COVID and eventually tested positive outside of Good Samaritan. So that's an important note. As soon as we learned of that, obviously we took all of the appropriate steps, but want to be very transparent with our community as to those cases and how they develop, and assure you that all of the steps that are being taken, all patients coming here are still, it's extremely safe. All of our employees are looked after, and all of the precautions that are in place are for their safety, but certainly want to communicate those facts as they come about.
And many patients inquire immediately as to, well, where are those patients? And the answer is they're at home, and they're being cared for at home, and we're monitoring their symptoms. And who are those patients and where are they? Well, it's Adam, it's me, it's Tiffany. We're all potentially those patients. So we need to make sure that everybody understands that it doesn't matter if the number is 2 or 4 or 10 or whatever, that we all proceed in the same manner that we have been, which is social distancing and monitor your own symptoms. And if you do happen to be one of the patients that catches COVID, then we want to make sure that you're comfortable with that process. And we have a lot of educational resources on our website as far as home care is concerned. And like I said earlier, the important thing is just if for whatever reason you don't find that you're recovering as you would expect, or you worsen midway through the illness, it's important to get in contact with us. Tiffany, you have some online questions?
We do have some questions from Facebook. So one question is the strict guidelines for testing giving people a false sense of safety because there could be more positive cases in their area than what is reported?
Sure. So I'll make a couple comments, and I know Dr. Stine will have some as well. We've talked about this at length. I think the first thing that I would say is positive, negative. That shouldn't give a false sense of security, because our communication has been that we should follow social distancing, shelter in place, good hand hygiene, regardless of results. So the limited testing, really, it can have an impact on the data represented and how epidemiologists and the CDC uses that data for identifying that peak of the curve. But as a community, we should assume that everybody that we come in close contact with within that 6-foot radius could potentially be positive. And in all honesty, that's how you should approach your day to day until there is data to tell you otherwise. Dr. Stine?
Yeah, I think if you rewind a couple weeks or so when we first started talking about this and listening to Dr. Fauci, his first comments were that the testing didn't matter. And then within literally about a week or so, then it was all about the testing. And what Adam said is extremely poignant, in that the testing matters in terms of analyzing the spread of the disease and where the peak of the curve is and so forth. And one of the things I said a couple weeks ago is this is kind of like a financial recession. You don't know that it happened or when it peaked until it's all over with. And so we don't know exactly when things started, and we don't know exactly when things will end. But the more data that we collect, as Adam said, on the epidemiology side, then we get to see where that volume is and statistically be able to look at it. And I can tell you, I'm not a statistics guy, but I live it every day now. And kudos to my math teachers in high school that made me go through all that. But it's important that now we're going to be able to use that data and leverage that, but it doesn't change anything about what we do. It certainly does not change treatment. It doesn't change the management, the prevention, the mitigation, all the things that you hear people talking about, but it just gives us more information. And so what we're going to have hopefully within the next couple weeks or so is a rapid test that gives us a result within about 15 to 30 minutes or so, and then that testing will help us in that early triage process, and also helps us as far as tracking the disease spread within our community.
Another question is, if 19 goes away after all this pandemic is over, is there a chance it can come back in the future?
Yeah, it's a fantastic question, and it's something that we all kind of ponder on a daily basis as to what the future is going to hold. The exciting thing is because the entire world is dealing with this, the scientists sharing information has been spectacular. Crosses borders, crosses countries, doesn't care about politics, religion, or otherwise. And so the process of a vaccine being initiated started many, many months ago when they were doing the gene sequencing on this. And so what we hope is going to happen is that lots of people will get this, and lots of people have very mild symptoms, and lots of people will get immunity to it. And then those that potentially don't get immune to it will likely be vaccinated sometime in the future. And the people who are working on the vaccines are looking at a timeline, hopefully less than a year or so, for that to go through. But the important thing to realize is that this is a normal process with a virus that passes around just like flu does every year. And whether or not it's going to change or our immune systems are going to adapt to that, we don't really know yet. But we know if everything plays out as it has with our previous epidemics and pandemics like H1N1 and things like that, that this won't rebound again next year, and that we will have immunity to this. And there will be many, many more people within our communities that have had it, that have immunity that gets passed around, and that protects all of us.
That kind of answers part of the next question, which was, how do we know that Indy or surrounding counties are staying away from Knox County? Is this something everyone will eventually contract?
Potentially, yeah. Potentially everybody could contract this, but it's not likely. And the important thing to realize is there are lots of us that are out there right now that have probably come in contact with this, that have had mild symptoms and already have immunity. And so we know that in the large population centers that's already happening. And so the issue is, and the reason that you keep hearing the word novel, and that's a confusing term to a lot of people, but novel, just consider that it's new and it's unknown. And so it's unknown to the medical community. It's also unknown to our immune systems. And as our immune systems come to pass and realize what this virus is and develop immunity to it, just like we do many, many other things every year, that's going to reduce the spread of this. So even if only 50% of the herd has immunity or 75% of the herd has immunity, that's what protects everybody else. And so it's important to realize that not everybody has to potentially get it, not everybody has to be vaccinated, but you won't have a pandemic or an epidemic the next time because we're going to have already seen this once. I've been around long enough to have been through the H1N1 a decade ago, And we've seen that that hasn't had any resurgence like it did previously. Now, we've been vaccinating for regular influenza A and B and H1N1, but that's not going to change anything about what we're doing right now.
And given the worst circumstances possible, will GSH be able to provide in-house care to critical patients, or will they be shifted to other medical facilities for further care?
Sure. Great question. And that's all part of our planning aspect of being prepared for potential surge of patients. The short answer is it is going to take a regional and even statewide effort to take care of all the patients, given that it is worst case scenario. Now, I will add that I feel confident that if we look at worst case scenario and best case scenario, that we would trend closer to the milder aspect, as long as everybody is staying focused on social distancing and shelter in place. And I know I've said that probably 15 times in the last 25 minutes, but it's so important. We know that it works, and where Knox County and our communities, I think, have an advantage to staying away from that worst case scenario is that those steps were enacted before we started seeing widespread transmission. Unlike some of the larger populated areas where it was more reactive, we were fortunate to be able to be proactive in that. It's not a right or wrong, but I feel like we will avoid the worst case scenario. Now, to just make sure I answer the question directly, if you go online, do a quick search of worst case scenario and modeling of capacity, the capacity of the healthcare system across the United States cannot meet the worst case scenario of COVID-19, and that's just a very factual statement. So it's not the healthcare team, it's not the hospital GSH, it's not the surrounding hospitals, it's the community and how we respond to this. Because as we've talked about, as Dr. Stine just mentioned, the majority of patients will be 80% will be mild and not need hospitalization, but there's up to 20% that will need hospitalization. And in a worst case scenario, if 20% of our population needs hospitalization in the matter of a month, we cannot meet that need, as no hospital in the country can meet their community's need if the community doesn't help to support the steps that are taken to stay away from worst case scenario.
And what Adam's saying there is that we can handle the capacity as long as it's spread over a long enough period of time. And that's what everything that we've been doing for the last 3 or 4 weeks is about, is if those patients come in 10s and 20s at a time, we're completely fine. If those patients come in 100 and 200 at a time, we're not. And so the process of slowing the disease progression with what's been done over the course of the past few weeks is exactly how we're going to accomplish that. And so increasing our bed capacity, increasing our critical care capacity, making sure that we have all our protocols in place and our staff in place is how we're preparing for that. And then as those patients come in, even though it's going to be a greater volume than we would typically deal with, it won't be so much that we can't handle it.
A couple of more questions for Dr. Stine. This past winter, several people had unidentifiable respiratory illnesses. They think it was COVID. What are your thoughts?
Well, that has been on everybody's mind, including my own, over the course of the past few months or so. And the fact of the matter is, we think that's very unlikely. The fact of the matter is, we all, on a weekly or every couple week basis, come down with some type of viral illness. And I can tell you that we don't normally test for all of those things that we're testing for now. And so along with our COVID-19 epidemic, we're also having a human metapneumovirus epidemic, which actually we have every year. But because we don't test for it, we're not aware that it's human metapneumovirus versus adenovirus versus rhinovirus, which are all of our normal cold type viruses. So it's interesting to note that I think that thought goes through everybody's head, and the place that you should take that thought is if you did have those symptoms a month ago or 2 weeks ago or 6 weeks ago, then you have immunity to it. You don't have to worry about it. But my take home for all of the patients is pay attention to your symptoms. I have had patients over the course of the last few weeks or so who have had something that we were fairly certain was probably coronavirus, COVID-19, and their symptoms came on and they were relatively mild, and then they were about halfway through what the illness was and they got sicker. And those patients contacted us, came in and got tested and evaluated, and then at that point in time we can determine if there's anything else that's a contributing factor, meaning is it pneumonia, is it something with flu that we can treat. But that's the important take-home point when everybody gets home care instructions, is to realize that if for whatever reason your symptoms worsen 5, 7, 10 days into the illness, it's important to get evaluated because that's where we can have an impact on making people healthier.
Okay, and this one is, if you have received a pneumonia shot, are the chances of getting pneumonia from the virus slim?
The chances of getting pneumonia from bacterial pneumonia for which you were vaccinated are less. So there are lots of different types of pneumonia, and for many people what happens is they get some type of other illness first, meaning they get a viral infection that puts them at risk for getting pneumonia. And the pneumonia vaccine that we particularly vaccinate folks who have chronic illness for, or people over the age of 65, is pneumococcus, which is a specific type of bacterial pneumonia. The pneumonia that we see that's associated with the COVID-19 is a viral pneumonia, and it involves fluid accumulation and mucus accumulation in the lungs. And that's why we think that midway through the illness point is so important. So they get the mild symptoms and those move into the lower respiratory tract. And if they move into the lower respiratory tract, that's when you get short of breath. So we've all had a cold, we've all had horrible congestion, and although annoying, it doesn't make you short of breath. But if those symptoms progress down into the lower respiratory tract and you get fluid accumulation in the lower respiratory tract, that's when you actually start getting short of breath. So if you get out of breath when you're doing your normal daily tasks at home, walking to the mailbox, doing your normal exercise, that's something that we want you to communicate to us in the medical profession to help us figure out what exactly is causing that.
Okay, there's one more question, and I think it's probably more for the health department, but with the president's new recommendation about social distancing until April 30th, do you see Knox County requiring salons, tattoo shops, and businesses of that nature to remain closed until April 30th?
Yeah, and much of that falls to Knox County Health Department, and they work with the public health officials across all of the counties in the state and have statewide discussions. I think what we'll see is where that trending of the illness of COVID-19 goes. If that's trending up and there needs to be a stricter, stronger response, then yes, as a community, we'll see our health officials start to define essential and tighten that down. You know, when you look at some of the data out there, there's shelter in place, and then there is Wuhan, China shelter in place, and it's a much stricter version of shelter in place. So the health officials will continue to talk across the state as to where they're seeing benefits. There are some communities that have been hit harder than ours that have already taken those steps to shut down per the health officials' guidance. Some of the areas such as were mentioned, and that certainly will be evaluated in Knox County as it is across the state and the country.
Okay. One more, and we will stop questions there. Are there medications or medication combos that can be used to treat individuals with COVID-19?
Sure. So there are a number of clinical trials that are going on in studying medications. You've probably heard, or if you're searching online, Plaquenil, hydroxychloroquine, and azithromycin is one combination that is being studied both for treatment and prophylaxis. There are also certain protease inhibitors, remdesivir. There's a number, I think the other day I read that there are 70 some clinical trials that are going on across the nation in studying the benefits of those medications. As a pharmacist, I'm going to put in my plug that the state boards of pharmacy and the medical licensing boards across all states are reviewing that information. There is a strong caution that has been put out as to prescribing those medications or taking those medications if you have access to them without a prescription. Just to be clear, those are medications. They are not benign agents. They have risk factors. They have side effects. One of the side effects with hydroxychloroquine is cardiotoxicity. So if you have heart issues, you may be at increased risk of taking that medication, and it may not be the right choice. Unfortunately, you may have seen through our Facebook post that there was a CDC alert put out regarding the use of aquarium products that have chloroquine in them, because there were individuals outside of Indiana that self-prescribed their own products and ended up being fatal for one, and the other ended up in the ICU. So medications are not something to self-prescribe, self-treat without looking at the risk-benefit Currently, we're looking at algorithms where we would use those medications in the inpatient hospitalized setting where patients are potentially getting worse and looking at avenues to help in their treatment. But there are no approved treatments for outpatients, which is that 80+% of individuals that have COVID. And Dr. Stine, I'm sure you can add to that.
Yeah, I think the exciting thing is that the clinical trials that are going on are not going to take very long to figure out. So whereas normally it might take 5 to 10 years to bring a drug to market if it's for cardiovascular disease or for stroke or for diabetes, they're going to have data sets within 2 to 4 weeks as to whether the use of this as a preventative, a prophylactic, or a treatment is going to be helpful. And what Adam has said is exactly right. The important thing to consider is that the mild symptoms of the disease are nowhere near as dangerous as the cardiotoxicity and the blindness and the neurological side effects of the medications. So at this point in time, we want to find out through actual clinical data whether or not those medications are more helpful or more harmful. And the nice thing is, by the time that we start seeing our peak, which is within 2, 4, 6 weeks, that data is likely already going to be out there. And the treatment protocols that Adam alluded to are basically focused on patients that are very ill and in the hospital, or who are hypoxic, meaning they have low oxygen levels and potentially require treatment. So the majority of the people that we're going to see and that are going to be out there are going to be mild to moderate respiratory illness, and definitely would not justify taking those medications. So just use caution when you hear about those, that we're not holding anything back and medicine's not holding anything back. We just really want to make sure that whatever we do is helpful and not harmful. And neither one of us are taking those medications right now.
Absolutely.
All right, I think that's all we have for you guys this morning. Thank you so much for being here and sharing your wisdom and information on this.
Thank you.
And thank you. And if any of you have family members or friends who are frontline workers, specifically people who are working in the ER or in the respiratory clinic, thank them. They are the people that are putting themselves in harm's way. So we appreciate that.
Are we supposed to high five?
Yeah, boom.